Hi everyone, I hope you guys are keeping well. In this video, I'm going to talk about neck spasm. Neck spasm, it's a common condition that many people in some stage in their life experience, and in many cases it's not a big deal and you can actually recover with understanding what you should do about it in acute phase. In this video, I'm going to share with you a series of exercises that you should follow in your acute phase, and you can basically continue this for the first 2 to 3 weeks. And at the same time, I'm going to share with you 3 important tips that you should follow and literally stick to it for the next 2 weeks. If you've never been in this channel, my name is Bob, I'm a physical therapist, and the purpose of this channel is to help people like yourself with simple tips and exercise for quicker recovery. Make sure to subscribe my channel for my weekly update, and don't forget to press that like button. Let's get started. Before I show you the exercises, guys, I would like to share with you 3 important tips that is so important to follow while you're doing these exercises. With following these exercises and tips, you can actually recover quicker. The first tips that I would like to share with you guys is that you need to identify those activities that bothers your neck and try to modify those activities. That means if you know sitting on a desk and working in an office station more than an hour bother your neck, you need to break down that basically work task to maybe 30 minutes, go for a walk and come back and carry on. The same thing goes if you know lifting certain basically object can bother your neck and aggravate your neck, you gotta kind of improve your lifting technique or ask help in that acute phase for yourself. The second tips that I would like to share with you guys is going to be stretching. Try to avoid stretching your neck in the acute phase. One of the common mistakes that I see with my patient is that in acute phase, as soon as they feel a little bit of stiffness on their neck, they start to stretch their neck in a different direction and hold it there for 15-20 minutes, which is fair. But unfortunately, in acute phase, your body stiffening up your neck. Unfortunately, stretching not going to help you, and in this video I'm going to show you a different variety of exercises that can actually help you to relieve that pain and help you to improve your mobility. The last tip that I would like to share with you guys is that to improve your sleeping position. Now, if you're waking up in the morning with a stiff neck, that means that the way that you sleep at night, it doesn't necessarily help your neck to recover and get proper recovery and rest. In that case, I would literally suggest my patient to kind of like monitor the sleeping position and find out, okay, is that a pillow or is that a bed that actually doesn't help them to get a proper rest? In some cases, if you change your bed, mattress, or the pillow, you could actually have these symptoms eventually, and then I would basically suggest them to maybe change those pillow or mattress, or in some cases, literally position it in the most comfortable way. You might want to know what would be the best position for sleeping with neck pain or neck spasm, and what the study and research has shown, the most comfortable position that you can actually get rest and get a good deep sleep would be the best position for sleeping, which means there is no such things as, okay, I have to put the pillow in this position and get proper rest. Not really. Study and research has shown that if you find the most comfortable position for your sleep, that would be the best position for you to actually get rest. All right, guys, the first thing that I would like you to start to do after a back spasm or neck pain, you can use a hot pack straight away in the area that you feel is sore. You wrap it around some towel, kitchen towel, basically 2-3 layers, and you can actually holding on the area that is feel tight or feel sore. What hot pack does for you, it actually increases circulation around the neck, and it's pretty kind of comforting. That's what your neck and your body need in the acute phase. Specifically in acute phase, your body wants to actually get comfortable with that injury or spasm, and with putting a hot pack, that heat actually helps you to improve the circulation and actually helps you more comfort. You can keep that for 15 to 20 minutes around there, move it around different places, and you don't need to actually do anything. While you're doing that, focus on your breathing in and out, and let your body to actually relax. Try this as frequent as possible you can. You can keep it every 20 to 30 minutes once and hold it there for 10 to 15 minutes and literally do your daily activity. You can even work with it, you can drive, you can lie down and chill out. The second move that we're going to try in this routine, guys, is going to be isometric strengthening exercise for your neck. What is isometric exercises means? Isometric means strengthening a particular muscle group without lengthening or shortening the muscle. I'm going to show you how to do it, and you can give it a try. You can basically hold your hands next to the basically skull and apply slight pressure and try to resist that pressure with your neck. As soon as I do this, I can feel my basically neck muscle get activated, and this is going to be something that we're looking for. How much pressure I apply here is going to be 20 to 30% of my maximum strength. I'm going to hold it there for 5 to 10 seconds. I'll try to relax my body, breathe in and out, and hold it there for 5 to 10 seconds. I repeat the same movement for 3 to 5 repetitions and hold it there for 5 to 10 seconds. I can try this in every single direction. I can hold it for the side as well. Hold it there for 5 seconds, relax your shoulder, breathe in and out, and relax. You can do the same thing at the back. You can hold either both hands or one hand at the back of the skull, hold it there. 5. As you can see, my neck is not moving, is in neutral position in either direction, and I'm applying a slight basically pressure. Why isometric can be helpful in neck spasm? Well, study and research has shown that in acute phase, in any sort of injury, we're trying to avoid complete rest. And isometric exercises can be a great helpful tool for you to improve your neck basically pain, reduce actually the pain, and help you to improve your mobility. You can try this exercise once or twice a day. If you find it helpful, you can do it even more, and that can help you to reduce your neck pain and improve your neck mobility. Alright guys, the next movement that I'm going to show you guys is going to be active towel mobilization technique. I'm going to show you how to do this movement, and this technique can help you to improve your neck mobility and actually reduce pain. Now, when I'm saying mobilize, is not a huge amount of movement, but it's a tiny little movement in your neck vertebra that you can actually create that with the towel. I'm going to show you how to do it, and you can give it a try from 2 different angles. You're trying to looking for something like this kitchen towels and wrap it around together and create that basically as a loop. And you want to basically position this at the base of your neck, which means as low as possible. Which means if you can find the C7, which can be possible with palpating your back of your neck and find the biggest basically protrusion there, like literally that would be C7. You can start from that level. And what I'm trying to do, I'm trying to drop my shoulder down and slightly apply pressure, pulling the towel forward, and at the same time I'm basically extending my neck back as far as it feels comfortable. Remember that in acute phase, this can be tricky to the point that you don't want to push it to the beyond comfort. You want to play around your own range, comfort range, and slowly build it up. You want to hold it there for a few seconds, 3, 2, and relax. Coming all the way down, back up again. Breathe in and out. Good. Hold it there. 3, 2, and relax. If you find it is comfortable, you can actually bring the towel a little bit higher. Drop the shoulder, relax the shoulder. The same thing. Try to get the full range. Flex the neck all the way down. Back up. Where you find the stiffness and tightness, you can apply a slight pressure and hold it around there for a few seconds. 2, and relax. I'm going to show you the same thing from the side, get a better picture, how much I'm moving. I'm basically bringing the neck all the way down. I'm not applying that much pressure now, just holding the towel, bring it back up. I feel okay, I can go up to here, apply slight pressure, and slightly move my neck back. Hold it there for 5 seconds, 4, 3, 2, and relax. If you find that level is fine, you can slowly come up all the way up to the base of your basic neck. You can try this exercise once or twice a day. Remember, this exercise should be totally pain-free while you're doing it. Eventually, at the start, you might find slight discomfort, but as you're doing it a couple of times, it gets easier and better. If you find any sort of discomfort in your neck, like tingling or pain increase, try to avoid this exercise. The last exercise that I'm going to share with you guys in this routine is going to be chin tuck, which is a very simple but effective exercise. If you're suffering from neck spasm or neck pain, this exercise can help you to reduce your neck pain and also improve your neck mobility. Chin tuck is pretty simple, but at the same time, you need to watch this video carefully and see how am I doing it and follow my instruction exactly. For the chin tuck, you're not trying to basically extend or flex your neck. You're trying to basically strengthen the deep cervical muscle. To do that, you're trying to basically apply slight pressure to your chin and create this double chin. Would be the simplest way that you can actually monitor yourself. If you do this in front of the mirror, you can see whether are you doing it right or wrong. What I'm trying to do, I'm going to show you in two different angles. I'm applying slight pressure down to my chin and create this chin tuck. I can hold it there for, let's say, 5 to 10 seconds. 4, and relax. I'm gonna go back again. And relax. I'm gonna show you from the other angle. It's actually very difficult to talk while you're doing this, and that can be a very good kind of instruction for you. If you can talk, you're not doing it right. Relax the shoulder and move forward. Breathe in and out, drop down your shoulder. 5. And relax. I can feel a stretch straight away right here, but it's not an active stretch, it's a passive stretch. I'm going to do one more round. And relax. Down and relax. Try to practice this movement a couple of times and make sure you're getting the right technique. Chin tuck is very simple, but at the same time it's very effective. If you're suffering from neck spasm or neck pain, this can be a simple but effective exercise in acute phase. Give it a try and let me know if you have any question. I hope you guys find this video helpful. In this video, I share with you series of exercises and tips in how to improve your symptoms after neck spasm and how to actually get a quicker recovery. If you have any question about this video or neck pain or neck spasm, leave me comments underneath of this video and I would be more than happy to help you. I receive more than 200 messages a day and I'll try to personally answer every single question. In some cases, it might take me a longer time for you to get my basically reply, but I'll try my best to answer all of your questions. If you haven't subscribed my channel, make sure to subscribe my channel right away and don't forget to press that like button. Until next week, all the best.